But even when I have that right to my body, I have to make sure the court, the country has to make sure that that's protected. And so when we're dealing with this, in particular with consent, what's interesting for all of you is there is no legal stipulation that that has to be in a contract. Consent does not have to be written. Nothing need be signed. Apart from here, infertility treatments, so like IVF, every single stage of IVF has to be written consent, has to be signed. But in particular here, it can be express or implied. So express is what you do. You have a contract, you present it with me. Brilliant. In 98% of all operations in the UK, it is written. Simply written. And you have to sign off. In particular, the British Medical Association, British Medical Councils, have specific contract terms that have to be in that. And you sign it. But here's the interesting thing. Just because you sign it, doesn't mean that you can't pull it away again. Yeah? You can withdraw your consent at any stage. Any stage. And you guys have to understand that as clinicians. Because if you think that your patient is scared, in worse, you have to ask them again. Because they're allowed to remove their consent at any stage they want. Any stage. So the important part of that, again, written. It can be written or it can be oral. No form be needed. And in particular, what's really important is sometimes you're allowed to just believe that they are consenting. So if you're taking blood, for example, and I give you my arm, am I consenting? You'd hope so? You'd hope so? Because if you're going to take my blood and I'm handing you my arm and you can take my blood now, then you'd hope so. So there's certain things that you are allowed to just assume they are. But if you are in any way worried, you have to ask the question. Because what the court is going to ask is, were they acting in a way that should have made you think that they were? Does that make sense? We're good? Hopefully. And so for that reason, there's a lot of pressure on you to make sure that they understand the whole way through. There is a lot. The court is going to be asking that question at every stage, because if you ever get a situation like this, if you haven't been open and honest with your patient, you might have lost them. Does that make sense? And consent for that reason won't exist, and then you're in a whole heap of trouble. We don't want that. Don't want that. In particular, what I'd stress for you guys today as well is to understand that, like I said, because it doesn't have to be a contract, and it has to be ongoing, they can stop at any time. Obviously, once they go under, that's totally different. They're gone, aren't they? Once they're under anaesthetic, you can't ask the question. But there is no legal requirement for it to be written down. Yeah? A lot of private hospitals do have procedures for this reason, to make sure that you're covered, but understand that you can withdraw and refuse at any point. That's really, really important. So do not think that just because they've signed, they're sealed, they're good, and they've started, that means that they're holding on to that ride the whole way through. Yes? Famously, one of the most important cases that you're going to come across here said that this isn't being like on a Ferris wheel. Like, this isn't a Ferris wheel. This isn't a big attraction. This isn't a ride where you're going to strap on and hold on regardless, and you can't stop. This is your body and this is your life, and you have to make sure that you are clear with your doctor at any stage. We're good? Still good? So effectively, how do we know? So how do you know? If you're a clinician, how do you know whether they have that? How do you know whether consent is valid? It comes down, I think, into three elements, and these are the most important questions you have to ask yourself. So as doctors, right now, as future doctors, you have to ask yourself these three questions. In particular, the first one, like we said, is you have to be a competent adult. So the first thing in competence, the most important thing in competence, is capacity. Can they understand? Are they able to understand? You have to ask the issue of capacity, because if they don't have it, if they don't understand, then it doesn't matter how much you tell them, it's not going to go through. And there's reasons why that can be the case, but that's really important. Because if you, for whatever reason, think they don't have that, then you've got a problem. So you have to make sure that question's important. Secondly, you have to make sure, like I said, they can consent to something, but why are they consenting? Because they want to, or because their mother wants to, because their father wants them to, because their husband, their wife wants them to. Because if they're not free from influence, then that consent is void. That makes this not being there. So effectively, can they? So ability to understand, freedom to understand and to make that choice. So ability versus freedom, really. And most importantly, probably last as well, were they given enough information? Because your job, legally, morally, ethically, is to tell this competent adult who has the ability enough information. You don't have to tell them everything. The more the better, but you have to make sure that that decision they're making is an informed decision, that they understand it. If it is anything, any sort of risk, and we'll get into that, you have to weigh that up. Yes, absolutely. But if you don't give them, so effectively that's you. You have to determine as a doctor whether they can, whether they've not been coerced or forced, but you have a huge role in that. So all of you future doctors need to make sure that you're telling your patients enough. Does that make sense? Yes. Good. Because here, most importantly, first one to start with, point one, element one, is capacity. Now, anyone who lacks capacity can lack capacity for two reasons. So how you determine whether you, as a patient, are fit, well, able, any of this, is whether it's an impairment or disturbance of the functioning of the mind. Now, impairment is more long-term, so you're talking about conditions. Does that make sense? So do they have a medical condition that prevents them from understanding? Be that extreme forms of anything, any sort of mental disorders, schizophrenia, anything like that, anything that causes it, or even, in particular in elderly patients, dementia. That makes sense? Yeah? It's probably dementia, it's more theme here, or disturbance. Now, disturbance doesn't necessarily have to be medical, it can be partial. It can be things like severe phobias can be a disturbance. Yeah, so were they involved in a situation that made it traumatic? So for that period where you're asking them for consent, they might not have been of clean, sound mind. Yeah, so think about, for example, here in Manchester we had the bombings. If you've just been through a really traumatic event, if you as a doctor feel that they are not sufficiently in the room with you, you could argue there's a disturbance, maybe wait to give them more time, more support before they make a big decision. Yeah? But impairment, long-term disturbance, something that's fracturing them for a moment. If either of those things exist in your patient, consent can't exist. Yeah? If it doesn't exist, it ends there. They are not competent, you have to take over as a clinician and do what's best. Yeah? Unless they are, in any way, for example, if there's a parent, if there's any sort of child, that situation, then you go to them. So for capacity in particular, it again comes down to 3 stages. Yeah? Because the first thing you're going to ask me is whether my brain actually works well. Am I suffering? Do I get you? Do I understand it? Because the impairment or disturbance has to, because imagine this way, if you're just an anxious person, that's an impairment, yeah? Severe anxiety, do you understand the word?
Anxiety, stress, if somebody's anxious, they're very agitated and stressed all the time.
You could be anxious but still understanding. So you could technically have an impairment from your anxiousness, but that doesn't prevent you from understanding. Does that make sense? You have to not understand. So you have to not only have this impairment, but that impairment has to prevent you from being able to understand. Yeah? So you have to link the two together. It's not enough as a doctor, because remember, this all leads up to whether you can take over. It's not enough to go, yeah, they're severely anxious, I have to take over here. No, because the next question the court are going to ask is, did that actually prevent them from understanding? Did they not get it? Because if they didn't, these two things have to come together. And then lastly as well, it has to be at that time. Yeah? So it can be completely that they are not able to at that time, or they are. So you can't basically make an assumption, you can't guess. It has to be relevant to the time. If you're asking me right now whether or not I should have this operation, do I want this operation, you can't judge me by how I'm going to be in 2 weeks. Yeah? And this is where doctors really can come under fire, because you can have disturbances that really do prevent me from understanding in the future. Does that make sense? So if it gets worse, if it's a condition that gets worse, you can't judge me by how I'm going to be in a week. You have to judge me now. That makes sense? You good? Are we good? Are we with me still?
Yes.
So consent's really important here. For that reason, the first question, like I said, is ability. Because this is all about, am I able? Do I suffer from something? Does what I suffer from prevent me from understanding? Because if it doesn't, then you can't judge me as having an impairment. And then lastly, at the time. So you can't judge me in future, you can't judge me how I was in past, you have to judge me as I am. Yeah, really, really important. And that's the interesting bit of it, because what the court's effectively saying is, you can't make judgments. You can't. And what's really particularly interesting is that the Mental Capacity Act, here, you can't guess, you can't make assumptions, you can never make a decision about my capacity and clean your hands by going, they're really old. They don't know, they don't get it, they're past it. Yeah? You can't. You can't equally, by their appearance, well, they look really stupid. you can't do that. And you can't make assumptions about condition. So unless you can clinically prove that that condition has that impact on them, you can't guess. Yeah? You cannot guess, and that's really important. So you can't make assumptions. You can't. You have to have clinical evidence. You have to be really good practitioners for that reason, yeah? You have to back yourselves up. Any sort of guessing means that you are a bad doctor. Yeah? That invalidates consent. Anything you do to them is, oh, we'll talk about where it lands you, but you don't want to be in that position at all. And that's really, really important. In particular, when we talk about whether you're able to make a decision in terms of the impairment, because we know we're not judging your impairment by your age, your appearance, we're going to guess nothing. We're going to absolutely make sure that we have the evidence and the understanding behind us. But then, let's stop right now. Helpful. I don't know what's happened there. Ooh, battery's low. Are we good so far? Does it make sense? Is it going in? Any questions so far while we're sorting this out? No? Hopefully not. That's why it's presenting. Yay! We good? I know it's a very hot room. Thank you for understanding me so far. The important bit then next, because that's why, that's the reason, but then equally here, you are unable to make a decision if you cannot, and here's the important thing, understand information relevant to your decision. And this really shows how the court is putting some onus on you as a doctor, as a clinician, as a specialist, to make sure that you present that information, just like I'm trying to now, in a way that you get it. So your patient has to talk to you like your lawyers, because you're not. I'm going to talk to you as future doctors, future clinicians, and give you a context of something that's really important. Because you learn all of what you need to as whatever you're going to be, so doctors. What kind of other professions have you got?
We've got
all sorts, isn't it?
70% clinical medicine,
Amazing.
some traditional Chinese medicine, some medical imaging,
Wow.
health service management. What else?
All sorts, isn't it? Good.
Pharmacology, sorry.
Pharmacology. So this area of law touches you at any point of your medical career. You can't escape. This is the unescapable. And it's important for you to have a context of it so you understand, especially because this law is replicated in all Commonwealth countries. It's slightly different, and I'll talk about that in your sort of American, North American, and even Australian contexts. And it's changing. And what's showing a lot now, especially with the article that you have, is that it is really topical. Because so much of what's going on with this, with Charlie, with the baby, is about this. And it will this one case will transform the way you look at this. And it's deeply personal as well, because as much as you're all doctors, you're also all patients potentially as well. So this touches you regardless. So I quite love it for that reason. So today, we're not going to do anything I'm not going to talk about deep case law with you or anything like that. Purely principle based. Really getting your heads around core legal points so you understand what the backbone legally of this is. And that's really important. The basics of the law, so exactly what the law fleshes out and why, really get you to understand that. Other jurisdictions, so like I said, I'm going to talk about a bit where we potentially could go with this case in particular, where our law is headed, but how different we are in relation to other countries, because we are here in the UK, we're completely our own animal. But very much what happens in the UK is mimicked in other countries then, all the time. Points to consider, sort of ethics in particular is a huge issue, and then time for questions, because obviously we'll make sure you understand this. Now, in terms of all this, before I go to the next slide, what is really interesting about this entire area of law, why it looks like it does, is because for so long, the entirety of this area was bowing to your greater knowledge. So literally a curtsy to all of you for being higher individuals. Does that make sense? If you go historically, doctors are always a higher level. Yeah? You don't question them. They're right. Does that make sense? All the way back in history, they're right. They know everything, that's why you've come to them. So even by going to your doctor, you say you don't know. They must know. Does that make sense? Yeah? They have to get it. They're higher creatures, isn't it? Higher levels of human.
They still are.
Well, absolutely. The stuff you were talking about this morning, I was there just like, tip of my hat. Not my brain. And for that reason, you come for their expertise, don't you? And for years, eons, all of human history, think about even the oldest books that you've read. If a doctor is involved, that was it. They weren't questioned. There was no questioning of your capabilities, of your expertise, because I'm coming to you because you are better. You know it. And the problem with that is that you then determine what happens to the body of the patient. Does that make sense? I'm almost, by saying that you know more, historically, and even to some extent now, I'm almost giving myself up to your knowledge and saying you know better, so I'm trusting you, and that's a huge responsibility, to trust someone with your body at a time when you're coming to them, not because you're well and fit and healthy, but because you're suffering from something. So that's scary, isn't it? So really, you have a superpower then. As a doctor, don't you though? You do. And you've got a superpower. And the worst thing about that, the great thing about that is, we want to believe that all humans are good and that you will act in my best interest, yes? History says otherwise. And we know that for every good doctor, there's a bad doctor. And a bad clinician, and bad everything. So there's good and bad in all. And so law really only intervenes because of that. So if we could trust that you would always do the best that you possibly could, then this area of law wouldn't be as developed as it is. And the most important part of that is that in order for you to have a say, so almost what law has done is to put more power back to the patient. Yeah? So yes, you are going to a clinician, yes, you are asking for their medical advice, but you have a right in that needs to be protected. Yeah? So you have to be protected in what you should expect. But interestingly, that giving you that right is based on you being able to understand. Does that make sense? So the first question, and we'll get into why, is whether you are a competent adult. Now, competence is a big English word, but it effectively means, can you understand it? Are you able to? And we'll go into how and what that is. Now, understand if you are a fit and able adult. So if you are not a child, you don't suffer from any mental issues, you don't suffer from any conditions that will prevent you from understanding what your doctor is saying, then you have full rights. So even if they say you must have this operation, you must have this procedure, if you're a competent adult, you can refuse. You have full right of refusal, even if, and this is the interesting, if the reason is non-existent, whether that's because you just don't want to tell them why, whether that's because you just, I don't know, some people, and I've been in situations in a courtroom, have flipped a coin. Entirely possible, some people live like that. Irrational, so completely out of the realms of possibility. Not like irrational, so you're worried you're going to die of something that's completely clinically impossible. And this can be anything. This can be people who are afraid to get their wisdom teeth out because they believe that wisdom is attached to that. Right? That kind, and that's what I mean by entirely bizarre. So it can be anything. You could, for example, practice a religion such as Scientology and believe that this is going to kill you, and it won't. But you say no, regardless of why, even if it would kill you, so even if what you are saying, if you didn't have it, would result in your death, you as the patient, so long as you are competent, so long as this bizarre reason is not because you have a mental issue, one and the same might be a question. You are allowed to refuse. Because the law is saying as much as we're no longer bowing to we are seeking out your expertise, not bowing to it. And that's effectively what the law is saying now. You're seeking you out because you know more, but you are not surrendering anymore as cleanly as you. Does that make sense? You're no longer just giving yourself up. Good? Yes? Fabulous. The law in the area is divided across a large area. a huge, vast expanse of law covers this. And the most important is the Mental Capacity Act. Because the interesting thing is, and why I point to a particular competent adult, is if you're not, then and only then that can the doctor interject and do what's best for you. So that way we're almost going back in history and saying, right, okay, you don't know because you can't know for whatever reason, we'll get into why, and then, but you as a doctor don't just think you get to choose what you like, because that's not going to happen either. You have to prove, probably to the family and most certainly to a court, and probably in current UK terms to the British Medical Council, as to why you're going to do what you're going to do, because they're not competent to decide. So you do have to bring forward a very protected position, yeah? You have to back yourselves up. Now, this is the interesting part, obviously, especially now, especially with the Charlie case. Children are an entirely different part of this. Because we know they're not adults, obviously, they're kids. They're, in this case, a very small baby. But here, it usually falls to the parents. So if you are the mother, the father, and in particular, if you're married, it's both. If you're not, it's the mother's first, and the father would have to argue otherwise. Children then are determined by your parents because it is you are protecting them. You are meant to, for that very reason, in the best interest. You are hoping, as a lawyer, that that is what the parents are going to do. Yeah, it's your baby. You're going to act in their best interest. Yeah, that's what we're hoping. But, and this is where it gets interesting, if there's any dispute over what, for example, now, it's a very controversial treatment. Yeah? Complete, and we'll go into the seminar as to why, really controversial treatment. You really, really, really have to go back to the courts. Yeah? Because the parents in this case, and we'll talk about it later, are literally saying in their best interest, they think it's this. But the hospital feels so strongly that they're going to the courts. And this is the interesting thing, where the parents and really the hospital are so against each other, like they are now, you have to go to the court to decide. And it's only a court that can then go, right, this is what's going to happen. So this is what's really causing the issue now. So yes, best interest, yes, absolutely, not a competent adult, but a child. And this is really transforming law right now. In particular today, we'll see why. Now, interestingly though, if this same situation of this same child was happening, and they were a minor, so we understand what minor means? Minor is anyone under the age really of 17. Yeah? Less than 17 you're considered a minor in law. Now ordinarily what that means, what the law is saying very clearly here is, if you're not a competent adult, and you're not and by adult, therefore a minor, if I'm your parent, I decide for you. But if you feel very strongly about something, if you're 15, 16, in particular between 16 and 17, it's almost assumed, then you can actually be your opinion. So if you're dealing with someone of a competent nature, so how to put it this way, you can go and apply to the court if you consider yourself to be really strongly minded. So anyone, any child under the age of 17 can really apply to the court to be saying, no, I know what I want. I'm competent, I get it, I understand, and I want my voice heard. So if you're a child, or if you have siblings, so brothers and sisters, if they were here and your parents wanted them to do this, but they wanted to do this, they could apply to the court to get the right to do what they wanted. They would have to prove several things, but they would have to definitely prove that they understand, so their competence in here, they understand the procedure, and they understand any possible aftermath, yeah? But you can, so don't think you can't, so it doesn't completely, the court's allowing us to look at this differently. And equally here, the other part of consent, apart from understanding, is making sure that no one is forcing you. Does that make sense? Making sure that there's nothing else, not a stupid article, not anything else, but in particular familial pressure. You as clinicians have to make sure that there's no pressure. Because they can consent, but how much consent is it if they've got a gun to their head by family? If someone is forcing them, making them feel that way. Does that make sense? Mm-hmm. They have to be mentally capable to understand. But also, and I would be really kind of flagging this for you, if you present that in a way, like I could now, well above my head, yeah? So you purposely trying to make sure you don't understand, to sound clever, yeah? Sound like you are smart. Yes? If you do that, you're invalidating their consent. So make sure you don't in particular. Can they retain the information? So not only understand it, will it stay with them so that later, after the operation, after the procedure, they still get why it happened? Because that's important. That's for their mental state as well, as much as their recovery. Equally, with everything that you're going to present to them as good doctors, and you're going to tell them all the important facts, can they use everything that you give them to make that decision properly? Yeah? Right, there's so much risk here, there's so much risk here, so I'm going to do that. Can they weigh it up? Does that make sense? So they take everything on board and then make a decision. Because if they can't do any of these things, and equally, and probably more importantly, can they tell you and why? You are well within your rights, in particular under English law, to ask your patients, why have you decided that? Because that's almost part of you proving that they can do all of these things. Because if they can't, the law is really clear that they're not competent, they're not able, and you have to step in. Or someone else has to step in. Yeah? We're good? So asking the questions is really important. And remember, it's at the time. At the time. It's not hindsight. It's not looking into a crystal ball and going, how are they going to be? It's how they are now. You cannot make any assumptions. You can't be general. You have to weigh up what's in front of you. So like a good doctor, can they understand what you're saying now? Are they making the right decision based on what they should? You can't judge them by, well, because of, let's say, a mental condition, in about 2 weeks' time they're going to be like this. It's as they are now. Yeah? Remembering as well, if it changes, you are well within your right later, like they are, to refuse consent later. But if at that time they're saying yes, or at that time they're saying no, that's what you're judging them on. You can't make assumptions about, well, they're saying yes now, but they won't want to in a week. Yeah? Make sure it's about that time. It's really important. The next one. Now, this is a big one. And I think in our current case that we're looking at in the seminar, this is an issue that hasn't really been touched. But undue influence. So why? So the first question is capacity, ability. Yeah? Am I suffering? Is because of what I'm suffering, I can't understand. And lastly, in particular, at that time, am I making the decision rightly? Yeah? The next issue, the next point, is about freedom. Yeah? Why am I making that decision? So I can, beautiful. The next question is, can I freely? Yeah? Why am I doing it that way? Because we all know, we're lovely, we all have parents, yes? We like to please our parents sometimes, yes? Or our partners, our wives, our husbands, yeah? Sometimes we nod and we smile, but we really don't want to. But medically you can't do that because it's a body, right? And this in particular is such a hotbed, such an important thing. Because if you always want to please your parents and they're in the room with you, when you're giving consent, you as a doctor are well within your right to ask that parent to leave before you ask them the questions. Know that, understand that. If they're a competent adult, regardless, they have to be making the choice of free will. So the questions you're asking, always, is not whether there's persuasion. Is someone prompting them? Something pushing them? Because if it's someone else interfering, remember, point one, I, on my own free mind, can make an entirely crazy decision if it's my entirely crazy decision. Yeah? If someone else is telling me to do something, the law says no. There's no consent. Does that make sense? So if someone is forcing you, you have no freedom there. You cannot. So here again, the law's coming back to you and making sure that this, as much as it's not you, it's not someone else. Yeah? Because we're not back 50 years even before. This wasn't a question. This is really a modern context. So you have to assess the position. So if you're in the room and they're with a partner, let's say their wife or their husband, and you think there's too much, ask that partner to go. Yeah? Make sure it's on their own. Make sure you're taking steps to make sure that they're making a decision for themselves, not because they're pleasing someone else. And equally, is there something else that they might be thinking about? Yeah? That you think is too persuasive? Have they been persuaded by something you think isn't right? You are allowed to identify that. So anything from fake news, do we know what fake news is? Yeah? You know,
Yeah.
anything on Facebook that they might have read and go, wow, really? God, no. You're allowed to go, well, actually, please read this first, then make a decision. Don't, by all means. And equally, you have to make sure that when they're expressing it, that they're actually saying what they really want. Not what someone else wants. Not what they, in any other way, would have done. It has to be from them. Yeah? Because they're going to live with it, so it has to be right for them. It has to make sure it's right as well. The most important case that you're going to come across to show all of this together, in particular with undue influence, is a case of Riti. Now this had to do with someone who was, do we know what Jehovah's Witnesses are? It's a religion here, well more so, I'd say more American than it is here. They have a lot of very strange beliefs, but one of the beliefs is that the body has to be intact. So you're not allowed blood transfusions, organ donations, anything of that nature, yeah? And it's a very strong, resolute belief, they will not. And unfortunately, medical science they don't care about. The belief overrides medical everything. So in particular with this one, we have the daughter of a woman who's a devout Jehovah's Witness. And she's pregnant, and she suffered so strongly, and they kept on saying, you need a blood transfusion, you need a blood transfusion, you need a blood transfusion, and she refused, based on the persuasion of her mother. Does that make sense? Because her mother was saying, no, we're Jehovah's Witnesses, no. No. To the extent where she actually gave birth, pardon, that's a typo, a stillborn. So her condition was that severe, she needed blood transfusion that badly, but didn't do it because of her mom literally going, yeah? And she listened to her mother over medical science and unfortunately had a stillbirth. Now, to that point, that she still needed it to save her own life, that both her father and her boyfriend at the time applied to the courts to allow it to happen. Because they were saying the persuasion was so much, it was basically voiding her right. So they literally successfully applied to the courts for a declaration, this can happen, and this is effectively what the courts are being faced with now in particular, but less from the persuasion side. That makes sense? So what the court is showing us here is, you can have the ability to decide, but even if, like we said, crazy, bizarre beliefs, we have to acknowledge, yeah, that's what they are, but it wasn't hers. It wasn't her belief, it was her mum forcing herself on it. Does that see the difference? If there was no one in that room and she was going, no, I'm not having blood transfusion, no. And you knew there was no one else influencing you, fine. But what that case makes really clear is that you as a clinician have to keep your eyes peeled, keep your ears peeled, and know that that's why. Yeah? Making sure that it is their personal, because this is your body, not your mother's. So you have to make sure that that's a really clear one. Making sure equally, by all means, you guys are persuasive, aren't you? So the interesting other side of this is that you can have what's called legitimate persuasion. And that's where you, being really good doctors, is so important. Really good clinicians is so important. Making sure that you present the facts correctly without a sway. Does that make sense? Consent law is really clear that you can't tell me what you would do unless I ask. Yeah? So unless I go, so what would you do? Yeah? You're not selling me a car, you're selling me something that's going to change my life. Yeah? So you have to make sure that you're going to tell me A, B, and C, and put it on a plate to me, and don't tell me what you think until I ask. Yeah? Be careful on that one. It's hard. I can't even imagine. Because you're probably sat there, like I am, when I have to try to teach something I'm really passionate about, but I have a really clear position on. I can't teach my students like, this is wrong. You have to tell them everything. And then I slumped it. We're all right. But that's the way. You have to make sure that they're free from that, because persuasion is a big issue. Sufficient information. The next bit. So, if I can, brilliant. If I'm mentally able, I have the ability, I've not been persuaded, I've done it freely, yeah? The last point, and the most important point, comes back to you. Sufficient information. And here it gets really difficult, because if you don't present sufficient information to me, you are automatically guilty. Ooh, scared now. Yes? And that's the important thing, because failure, so if you don't tell me enough information, then I've got you. You pretty much just find yourself a lawyer, everything will be okay. Just get a lot, literally. That's how important it is. Information and giving me enough of it determines whether or not you're liable as a clinician, without question. Now, in particular, less information, understand this is how a bit interesting here. Battery is criminal. So that's a criminal offence. And that is where I'm saying that you told me so little that you touching me is wrong. Yeah? Whereas negligence, more information is needed. Because less information is needed for battery, because I'm just claiming that I did not want you to touch me. Yeah? Negligence is another area of law, and it's where I'm saying you're being bad doctors. Batteries, I'm saying you're just doing something I don't want you to. Stop. Yeah? Negligence is me saying you are actually bad. Do we understand the difference? Not enough information, too little information in particular. You've not told me enough where I understand what you're doing, so you touching me is wrong. See what that difference is? Negligence is attacking your actual credibility as a doctor. And information here, the important thing for information is, it's making sure that you tell me what I need to know without scaring me too much with it. And that's hard as well, isn't it? Because you need to make sure that I know enough, that I understand enough, but equally, you have to make sure that you're not misleading me. So if there is new information, this is why it's so hard for you. Because there's research all the time, medically, isn't there? It's constantly going. Now, you are not expected to know at that second everything. But you have to here apply yourselves and be very, very careful in what you do tell me, and that you tell me enough. Because if you don't tell enough, it's really important just how far this can go. Now, in terms of rarity here, battery is really, really rare. So the criminal side of this, you're probably never going to see. In fact, so much so that the only cases that I can really, really show you of where not telling me enough information was wrong and battery-ridden is people, for example, Richardson is a great one. It was a person who's no longer a dentist. They were struck off the registers. Does everyone understand that? They were no longer dentists, they were just practicing for money. Is that you haven't done something that I would expect a doctor to do. Yeah? So you haven't told me enough information, you haven't provided me with the tools I need as your patient to that level that you're a negligent doctor. Yeah? And that's a big deal. Negligence is something once you're slapped with, it's very hard to stay a doctor. Yeah? It's really, really hard. And in particular here, what's interesting about it is that all you have to show me in terms of battery is that you've not told me enough, so you're touching me and that's wrong. In negligence, I'm attacking your profession, your professional standpoint. Does that make sense? So I'm saying not only have you not told me that, but if you had told me, I would have said no. Yeah? That's the kind of level. Does that make sense? So I'm saying something you haven't told me has completely changed it. Now the most famous case in particular here is Bolden. How is for time? I'm not even checking.
Okay.
We good? We good for time? I'm trying to kill you in the water room as well. Important cases here. Does everyone know what electroconvulsive therapy is? Probably not. It's a 1957 case, and it involves a guy who had to be, well, they used to believe it or not, hooking you up and basically electrocuting you. Do you understand electrocute? So like literally if I were to take this and literally electrocute myself with it, yeah, literally into that. They believed for years, how many years? Like forever,
Yeah.
that electrocuting you could solve all sorts of things. Everything from infertility, sorry gents, to mental illnesses in particular. There was a large belief that electricity into the body could cure you. And the most famous case is Bowler, because what they said there is that, believe it or not, they hooked this guy up to enough volts now, in relative terms, to restart a car. That's how much went through his body, that much. And they said it was that bad because he wasn't told that he should have been harnessed down. So he wasn't at all attached to anything, and he was flailing around and hurt himself loads. Now, it was held there that you can only be acting properly if you inform me of not inform me of something that's a small risk. Does that make sense? So if you are deciding what to tell me, what not to tell me, if there's, for example, new research that says there's a 3% chance that, you don't have to tell me that. Because that's minimal. Does that make sense? If it's minimal, you don't have to tell me. That is the case that tells us that. Because there was a minimal chance that he could have hurt himself more. He wasn't told of that minimal chance. Because of that, he's fine, because it was minimal. The difference the court is showing us is, if it's 10% or higher, you should be telling me. Yeah? If it's 0.1%, 1%, 5%, you have no need to tell me. Especially if you think that that's going to scare me more and make this worse, yeah? So that's important. In particular here, the most important thing is, once it is significant, once I should know, then not telling me is negligent, yeah? But you are allowed to use your superior brains to not tell me something that's small. Yes? We're good? Good? Fabulous. In particular, what important questions here, right now, in terms of significant risk, because that's the question you're asking is, you have to tell me everything that's significant to my case and my position, and whether all of this I need to know. And what makes it significant currently, and this is what's really important about our case, is what we know now and how much of an influence it's going to have on my position. Yeah? We'll talk about it more in the seminar. Does that make sense? So if it's enough that you would tell your sister, your brother, whoever else. So if this was like your brother who's undertaking this operation, would you tell them? That's almost the question the court is asking. Does that make sense? So what would you not tell me? Why are you not telling me? Because if it's significant, I need to know. I need to know. So less than 10%, probably quite clear. More than 5, well really more than 10, definitely more than 5 potentially. Yeah? Weigh it up with your professional expertise, but you have to be able to back it up as well. Yeah? Good? Now, in terms of reform, we've seen how much is being led by you. Yeah? There's so much of this that is all down to what the doctor thinks, how you perceive me, whether I'm mentally able. Does that make sense? It's a lot and a lot of weight on you. And I can attack you for it. I can take you to court for battery. I can take you to court for negligence. But the American system in particular is now turning it based on what I want to know. Not what you think I should know, information-wise in particular, but what I, as a, well, effectively a competent patient, should want to know. So there what it's about is, instead of just telling me everything, almost telling me in increments and then asking me when you want to stop. Does that make sense? So you're going, understood? Do you want to know more? Understood? Do you want to know more? And going that way, yeah? And making sure it's from my position. And that's really interesting. Equally, Australia is to the point where you have to tell me everything. The Australian system is basically tell me everything or else. And that's difficult. That makes it really hard for you, because from a practitioner alone, it's hard, isn't it? You could scare me with that. There could be a 0.5% percentage of what I could potentially suffer, but it takes it away from you. So we have a prudent patient position. Now this, ironically, today is what we're going to be focusing on a lot, because in other jurisdictions, what's happening now would be a question. Probably why Trump's getting involved is because that's the American position. It's all about what the parents want, not what medical professionals intervene in. In terms of the last point as well, and I'm not going to hurt you too much with this, but it's a causation issue in particular. So what you have to ask yourself when assigning any sort of information to decision and to consent is what an objective position or a subjective position. And that makes it really hard, but I'll boil it down to you in this perspective. Here, when we're dealing with what I would do, yeah, what the court is asking in the final way, the only way that you can sue me, the only way I can sue you, rather fun, is if what I've decided is what you should have told me, if that's lacking, if you're going to look at me objectively, so generally, like any one of you, that's the difference. Does that make sense? So would a person of normal 30, unfortunately 33 years have made the same decision with what you told them? Or whether you're going to be specific, subjective to that person. And the court is open to both, and that's what makes today much harder. Does that make sense? So you're either going to look at me exactly as I am to the world, or you're going to be very specific. And the court have shown us that either is possible. So in particular, I'd say the most important part of this is that we're seeing, especially now, especially with today's case, that in particular now, and I'd say this very, very delicately, you do have a defence of therapeutic privilege right now. And what that defence is about, so that there, is you saying that you do know better, and that you acted according to the professional standards, yeah? So you did what a doctor would do. And that's fine, but what the court is showing us is they are more on the side of the patient than they are on the side of the doctor. So be aware of that. Don't be too scared of it, be aware of it. And in particular, you can have situations where the patient can say, I don't want to consent to do what you want to. And that involves a very simple contract. Does that make sense? We good?
Yes.
Hopefully. I know it's a boiling hot room, so I don't really want to completely, I'll round it up by Remember your 3 points, yes? Am I able? If I'm not able, or I'm too young, or I'm affected, then you have to take over. The parent takes over as a child. The state or the courts or the hospital have to take over if it's something else. If it's a parent situation like we'll see, parents versus the actual surgeon, the actual clinicians, the court have to decide. That's consent. Apart from consent, freedom is anyone forcing me. If they're forcing me, consent doesn't matter. You have to act as they would without that. And then the third is, have you told me enough? Tell me too little, and you can be a criminal liability and remember, criminal liability, prison. Anything else, money. So either is wrong. Either's going to hurt. And make sure you have those 3 elements. So as long as they're able, free, and informed, consent is clean. We're good? Fabulous. I'll see you in the seminar. I'm so sorry for keeping you this hot room. Is that good? Any questions?